address the Public Safety and Courts Committee? All right, seeing none, we'll move to our first agenda item. I would entertain a motion to approve the purchase for Allied Universal to replace the jail intercom system in an amount not to exceed $13,848.16 from the jail commissary fund.
I'll make that motion, Mr. Chairman.
Seconded.
Is there any discussion?
I did want to note that in the quote it says they are going to attempt to use the existing wiring, and if not, that would be if the existing wiring does not work, that'll be an additional cost.
Right.
So this may come back with
It's an additional cost. It won't be more than $5,000, which is within my authority, and I'll just approve that part. But this is an intricate piece of equipment. They need to communicate back and forth, and they're going to try and go to a digital versus analog system so it can work.
Analog is pretty old.
This is a really old system that's in
Yes,
there.
analog has been used in what, 25 years?
Yeah, it's been a while. So if the wiring does have to be replaced, it will be an additional amount, but I can approve that amount.
Okay, any other discussion, questions? All in favor of moving this agenda item on to tomorrow night, say aye.
Aye.
Any opposed? Okay. Before I last call the public, I actually have a question about the opioid settlement. What is the status on that? I'm talking to some people in other communities who are already having community conversations about how they're going to use that money, and just wondering kind of what the status is for us.
So Tracy attended a webinar on it the other day, and so we're looking at what the split has to be, and they're starting to have, the MML and the county association MAC is starting to have different webinars on it, but that's as far as we've gotten on it.
So was that a webinar that was with the Attorney General, do you know?
I believe it was that one with the Attorney General.
What do you mean the split?
So a certain portion of it has to go to the courts,
Okay.
and then the rest has certain things that it can be spent on. So they're talking about what that settlement will look like, when it will be paid, and what that split is, and what it can be used for.
I have a list that someone in Genesee County sent me of kind of what all of the allowed.
I believe it mostly has to, the specific ones for courts, I think has to go to some kind of treatment court.
I think you're right. I read that too.
So we've attended the webinars
So
at this
when
point.
will there be sort of a public announcement about what the amount is and that kind of thing?
I have not gotten an official thing from the attorney saying that here is what it is and here is the official amount.
Okay.
As soon as we do that, we can do a press conference, you can do an announcement, you can do whatever you want.
Am I remembering that's a yearly amount for
18 years, I believe.
Yeah,
just so
amazing.
there'll be splits and that will, as far as we know, be the same year after year.
Yes.
So every year we'll be deciding.
Every year, it's something like 20% will have to go to court, and then the rest will be able to go to other things in the county. And don't quote me on the 20%.
Right, I understood, but every year it'll become a decision what to do with that money as far as the part that we have, that this board will have control over.
Correct.
Okay, within the limits of their requirements, obviously.
Okay, thank you. Just curious about an update for that. Second call to the public. Is there anybody else that would like to address this?
I do have a quick question. Just curious if anybody here can tell me, possibly it's just on my mind today, when the jail's gonna open again?
I do not know
What
the
do you
answer
mean?
to that question.
Are people gonna be housed at the jail again?
We're housed at the jail.
Okay. Everybody?
Certain offenses you're able to be arrested for and housed, but not all offenses.
That's what I was wondering.
Yeah.
Okay.
They've opened it up to more offenses.
Okay, so it's kind of a progress.
Yes.
Okay.
I guess the sheriff would be better able to answer that question.
With Sheriff
Yeah,
and Tammy Wilson.
I will give them a call. It was just on my mind today.
Well, and I know that there's been some changes at the state level about who goes to jail and who's actually out just on sort of a tether program. They've been increasing, the number of people that have, what you have to do about posting bond and that sort of thing in order for the system to be more equitable. So I think we probably will see a continued reduction in numbers at the jails just because of the change in sort of criminal jurisprudence. But yeah, I'm sure we can find out that information, kind of what the rollout schedule is, if there is one, that kind of thing. So thanks. And would you mind just filling out I don't know, maybe Caroline's got your information, just so we have a record of who spoke in public comments.
Thank you.
Okay. Anything else? Anybody else wish to address the committee? If not, this meeting is adjourned.
Thank you.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Alright, first call to the public. Anyone? Alright. First agenda item. I would entertain a motion to approve the MSU extension renewal millage at a rate of .0760 for 6 years and place this on the November 2022 ballot.
Support.
So, second.
Okay, we are now open for discussion.
So I would like to respectfully request that the board approve the request to be on the August ballot. In conversations that I've had with the chair, Greg, Dr. Boggs, the board previously, I've always requested August. I
Okay.
don't know how it got changed from August to November. That's the board's prerogative, but if you guys are entertaining a motion, the motion should reflect what the request was, and the request was to be on the August ballot.
Did we just, is it a typo or did we make a mistake?
I don't think that was us at all.
Yeah,
Yeah.
So whatever you guys wanna do with it.
alright, would we like to have
That's
an
his
amended
request.
motion?
I'll amend my second if you care.
Thank you.
It's not too late to get it on there?
No, that
Okay.
deadline is May 10th.
Pardon?
May 10th by 4.
Okay, that's why I wanna ask.
Is there a benefit to August over November, you think? Like if it fails, you still don't have enough time?
Yeah.
So that's the one benefit. The other thing is I have 2 other counties going for millages in August, so we can coordinate all our efforts rather than having a split type
Sure.
approach. So it's a twofold purpose.
Sorry about that.
No,
This
that's
is a
all right.
renewal,
Thank
not
you.
an increase. Is that, we talked a little bit about a possible increase, this is not an increase.
Alrighty, so we have the amended motion to read August 22 ballot. All those in favor signify by saying aye.
Aye.
Aye. All those opposed the same. That motion moves on. I would entertain a motion to reappoint Vicki Bochek, Bruce Cadwallader, and Kirby Vogel to the Shiawassee Health and Wellness Board.
Support.
Second.
Okay, we have a motion and a second. Anything on this, Gary? You're on that.
I'm on that board and they've been on it quite a few years, especially Vicky. I think she's been on it. I've been on it 8 years. I think she's been on it longer than I have.
Yeah,
And I'm on the nominating committee, so,
okay, that's what I thought.
So if anything goes wrong, it's not your fault.
yeah.
Call Gary.
We just had we just had 2 new ones last month too.
So those people would be at our meetings this month, the new people then?
Yeah.
Okay. Alright, anybody got anything else? Alright, all those in favor of moving this forward signify by saying aye.
Aye.
Aye, all those opposed the same. That moves on to tomorrow. I would entertain a motion to approve the use of up to $30,000 from the Solid Waste Fund, Waste Management Fund 230, to fund 2 household hazardous waste collections in 2022. And I see we have Larry.
So moved.
Support.
Support, moved and supported, open for discussion.
Yes, this is the funding for the annual hazardous waste collections. We do 2 a year. This year's satellite collection is going to be in Perry, and that's in May. And the Owasso collection is in October. We're asking for up to $30,000, which is the same amount we requested last year. Last year I spent $20,000, so I came well under budget. But costs have gone up considerably this year, as everything. So I want to keep it at 30 just to give us some cushion in case we need it, because I anticipated it's going to be busy. Very successful program, funded by the Solid Waste Fund. Question?
Do they take old tires too?
No, they don't. We take those at the tire collection in conjunction with the river cleanup.
Oh, okay.
Yeah.
I think the end of July.
So can you give us some examples of like what this would be?
Mm-hmm. So when you go in your garage or in your basement, when you start looking at antifreeze or bug spray or fertilizer for your yard, those are the basic ones that we see a lot of, but then we also see DDT come in and stuff that hasn't been sold in 50 years, which that's always interesting. We take mercury, like the real mercury that kids used to play with in school, but now is toxic, or is toxic.
Wasn't that?
And so it's just amazing what comes in. A lot of pesticides, a lot of people just cleaning up paint, oil-based paint, thinners, latex. You can put kitty litter in and throw in your trash. It's water-based, but we don't turn it away if someone brings in latex paint. We're going to take it, but lots of stuff.
What about prescription medications that are?
We'll take it. We'll take it. They have the red barrels around the county in different locations for that, but we will take
I
it.
thought that was like for needles.
Yeah, we take those too.
Okay. Oh, it does? Okay.
So what's the deal? We don't want them throwing it in the ends of.
Yeah, we don't want it
I
in-
think I've seen that.
we don't want it in
Like they're
garbage.
Finding
We don't want it-
prescription drugs in our.
Yeah, we don't want it in the landfills. We don't want to get into the rivers.
Yeah, okay,
Lakes.
that's that. Dang.
20 years in this program. It's been really, really successful. Citizens love it. So-
What do they do with all that?
Well, a lot of it's incinerated. Anything that can be recycled through other means, that if they can put it back into another product, they will. But a lot of it is incinerated.
Pesticides and so on, incinerated. Okay.
Yep.
Several years ago down in Perry, Larry and I were working that day, and a lady brought in, it was a big box, and it was DDT, and it had to be from the 20s, and it had skull and crossbones right on the labels, and none of those bottles had ever been opened. It had sat somewhere for almost 100 years. Glass bottles, dark brown.
They used to use it to knock down mosquitoes, kill the bugs.
Very successfully.
Killed everything else too.
All right, so are there any further comments on that? All right, all those in favor of moving this forward signify by saying aye.
Aye.
Aye. All those opposed, the same, and that will move forward. Our last agenda item will be to accept the grant from the Michigan Center for Rural Health and approve the contract agreement and authorize the chair to execute the same. If I could get a motion?
Yes, my motion.
Support.
Well, this is a unique one. This is new. It's a grant from the Michigan Center for Rural Health, which is affiliated with Michigan State University. And we were not expecting this. This is beyond our budget. We did not expect these funds becoming available. So they were made available to rural health departments. And the money is from the CDC. And it goes to Michigan State, to the Rural Health Division, and then it goes out to the local rural health departments. And we have guidelines on what the funding can be used for, and we're having meetings right now as to how we're going to use it. We have a meeting with the people from Michigan State on Friday But one of the things you can use it for is school nursing, expanding of school nursing programs, hiring school nurses. Another thing is community health, hiring community health workers to improve health in your community, such as childhood vaccination rates, which have dropped off since we've had the COVID pandemic. You can do COVID tasks with it, but it's not specifically for COVID, which is very nice because our other funding for COVID is earmarked for that purpose. So this is a little bit more broad, and so we're gonna determine what the best use of the money is. Unfortunately, the time frame is short. We have to expend the funds by the end of May 2023, so that gives us just over a year. Typically, these things with the state, you just don't know how they're gonna go, but I think it's a great opportunity, and interestingly, we do not have to provide any match from the health department. So this is just accept the grant and then use it and then bill against it for expenditures.
What's the dollar amount? Or don't you
It's
know yet?
$191,000
Oh, gee.
and something else. It's in the contracts.
196.
I didn't read it in here real close.
191,186.
Yeah, 191,186. So very exciting. Lots of different ideas, lots of different needs. If you read through the agreement, you can see what tasks we can use it for. We had a nice discussion on how we're going to do that. We already have a team at the health department working on it, but we got to get some more clarification from Michigan State, and we will do that this week. So very exciting.
One area that a lot of us have talked about is the school nurse. I mean, when I was a kid, there was a lot of nurses in school districts. And of course, it kind of got lost in the shuffle through the years. But a lot of people would really like to see that on a permanent basis.
Yes, I agree.
Especially with what we've had last couple of years.
Before the pandemic, that was one of my big, dreams and goals, was to return school nurses to schools. It just takes funding. So it's tough because some of the school districts used to fund them. Some still do, but some more used to fund them. And then when the school aid cuts started coming in the 2000s, really 2010s, the low-hanging fruit was chopped. They were going to keep teachers and education staff, and rightfully so, but they lost the nursing aspect when, back when we were in school, that was there. And then the pandemic hit, and it was like, whoa, they could really use a school nurse. So I think there's more limelight, if you will, on the situation, that there is a need for school nurses. But that is really a state problem, because they need to fund it, at least from the state level, because we're ranked 50th out of 50 states going into the pandemic for school nursing in the country, and that is embarrassing. So we'll see if things happen. There is movement at the state level. I would like to see that come, but nothing's been communicated to us yet, and nothing's been promised. So we'll keep doing it. We have one in Durand, obviously through a grant. I have a school nurse. And some of the other districts, Shiawassee has one, and I know Perry, we have a social worker, so we've got some things that we're looking into. So I wish we could do it in all the districts, but it's costly. Nurses are very in demand. It's very hard to hire them. So anyway, thanks.
Thanks, Larry.
You're welcome. All right, do we have anything else on that? We covered it. All those in favor of moving that along to tomorrow signify by stating aye.
Aye.
All those opposed, the same. That will move forward, which brings us to our second call to the public. No? I do have one thing. I'll give you guys a very quick update on the Midwest Trail Authority. I'm looking at Karen because I forwarded her some information. The Fred Meyer Trail has an endowment. The principal cannot be touched. The interest is what funds the maintenance on the trail, along with a really, really dedicated group, friends groups, volunteers. I'm not one of those people, but I have sat with those people for 3 years, and they do an amazing amount of volunteer work, but it's also very costly. There has been talk of expanding that trail Representative Ben Frederick and I believe it's Graham Filler are being lobbied and are on board with trying to bring that trail 3 miles into the city of Owasso. Does anyone, other than Karen, because she knows the answer, want to take a guess at what that 3 mile expansion would cost, is going to cost?
I will little because you told me.
Oh,
Yeah, I'd be a very good guess.
yeah, $8 million. So, we've had some public comment, some
What
very
are they doing,
ignorant
gold
public
plated?
comment about moving it to, extending it to Durant. So if anybody wants to do the math, 8 million for 3 miles, and then just in your head, kind of think about what it would take to get that to Durant. It's gonna take a lot more than some private donations. And the money is not the only object. There are a number of obstacles, land being one of them. So, I don't know that this, there's, it might work, it might not. Even with $8 million, it might not happen. So, it's very tough. It's very tough to figure out how to get it from here, to get it from there, because people actually own the land in between. And it's not that simple. And you don't just have the trail, you have a 30 feet right of way on either side. MDOT, DNR. The DNR owns a portion of the trail. They don't own it all, they own some of it. There are so many entities in this. So just wanted to clarify if anybody has any questions on that project, I can refer you to some people that can give you the answers, but just know that it is not as simple as saying, yeah, I'm gonna form a committee. If you form a committee, you better have about $40 million, so, and a bunch of land between here and Durant. Anything else? Nobody's gonna follow that?
Are you looking for somebody to pony up 8 million for you?
No, probably not. All right, well, if we have nothing further, I will adjourn this meeting. Thank you.
We'll take just a